Hey guys, welcome back to Scanning the Mind. My name's Sanche, I'm a psychiatry trainee, and
My name's Varun.
Varun couldn't make it today, so I've replaced him with Dr. Kiran Majaria. I'll link his channel down in the description. For those of you who follow our channel, you will recognise him from a few previous videos. Kiran is a GP trainee, but not only that, he's also a YouTuber. Not only that, he's also a touring comedian. On today's episode, we're just going to kind of delve into Kiran's mind and find out exactly why he chose GP training.
Oh, I like the hype. I liked the build-up. Yeah, pumped. I'm ready for it.
So then, Kiran, you're a GP ST1, is that right?
ST2. You're going to do me like that, are you?
Yeah. When did you first start thinking about GP training?
I think towards the end of medical school, I was thinking about GP training.
Okay.
And then, because I thought it was something I might want to do, I tailored my foundation program choices. So as soon as you finish university, you do the foundation program, which is like your first jobs as a doctor. And I tailored my choices to something that would be useful for GP.
Okay.
The first full experience of it was in my F2 year.
How did you find that? Was it everything that you thought it would be, or was it very different?
My F2 GP I loved, but not because of the reasons you necessarily think. It was a bit of a funny one because I was placed there with two other doctors, one in my training program and one from a nearby training program. So there was three FY2 doctors working in this GP practice, and we had these super long lunch breaks and weren't expected to go on home visits.
Yeah.
So we had lunch breaks that were like 2.5, 3 hours long sometimes. And we thought it's a waste of time going home and things like that. So we actually joined a local gym. So at lunchtime, very often, we used to use our lunch break by going to the gym. And it wasn't like one of these pure gyms, the gyms. It was like a locals gym and also a health club. So they had a pool and a sauna and a steam. So my memories of my F2 GP job were sitting in a sauna with two other F2 doctors.
So you didn't really do much GP. You spent a lot of time in the gym / sauna.
We spent a lot of lunches in the gym,
Yeah.
and then outside of the lunches, we did obviously have our GP practice. And it was one of the first times where you are so independent.
Yeah.
You have your own room, you have your own patients that you see, you can follow those patients up. And I just love that.
It's kind of like being on call when you're doing a medical job.
Mhm.
On your day-to-day job, you're following the consultant around, enacting their plans, like you said, chasing up blood results. It's quite easy work, if anything. It's not, you don't have to engage that much with it. When you're on call, that's when you're really kind of by yourself, you're independent. You have to go around sorting problems out. You can always obviously ask the med reg for help, but you're working by yourself, which I imagine is the same as...
It's exactly that. So basically, you're having to think for yourself. No one else is doing the thinking for you, like you do in your day job.
Yeah. So you decided relatively early on in the F2 that actually GP is the thing that I want to go for. What attracted you towards GP?
So flexibility was a huge one. It's knowing you're going to start and finish time. It's also one of the ones where you can work part-time very easily. So you work in the blocks called sessions, and a session is half a day. So if you wanted to work 7, 8 sessions, 6 sessions a week, 2, 3, 4 days a week, you can do that very easily.
Yeah.
And so if you're having a family and you're planning to have children, or you do YouTube and you want to do something else on the side, then it works really well for that.
Yeah.
So that was one. The second thing is just having a bit of a sense of community as well. So being within the community, being able to see people, but then also see the impact of what we've done as well. Because in hospital, we initiate a lot of changes. That patient will get shipped off to another ward, or they'll recover from the acute thing and then they'll go home.
Followed up by the GP.
Exactly. Whereas as a GP, you can see someone, make a diagnosis, make a change, and then follow them up in a month's time and actually see that that's made a difference.
Yeah.
And as well, I love going to work, making a really nice coffee and just sitting down at my own desk in my room and not having to speak to anyone in the morning. That's my idea of a good morning. Come in a bit early, drink my coffee, check my emails, reply to some YouTube comments, and then just get on with my day.
Because you're very independent, aren't you? Kind of your day runs how you want it to run.
And as well, although it's kind of single, as in you work solo, there is also a bit of a team there as well, if you're in a bigger practice. So the practice I'm in at the moment, for example, there's quite a few GPs, and you find that if your workload is finished, so for example, if I finish my patients and the duty doctor, so the GP who's on call that day, who's seeing all the emergency things, if they're really busy, I'll just start picking them off their list towards the bottom and helping them out. And likewise, if you get really busy, someone else will help you too.
Yeah, and that's always nice when you have colleagues like that who can help you out, so that's good.
The last one I forgot to talk about is the business side of things as well.
Okay.
So being a GP, and especially if you're a GP partner, is like running a business.
Yeah.
And so my family have got business, and everyone's very business minded. So I've grown up around that too. It's something that interests me as well.
Okay.
So just that side of things, being able to very easily do that if you want to as well, was another reason that I chose people.
Yeah, and I think especially in general practice, a lot of doctors don't want to get involved in partnerships and things. So when you have GPs that do, then it's quite easy to find those opportunities and kind of become partners in good practices, because it's not that many people that really want that responsibility or want to look after this stuff.
Also, the training is much shorter. So the training for GP after F2 is 3 years, plus hospital is 7 years plus.
I think we're increasing it. I know there was some talk about going to 4 or 5 years.
They keep talking about it. It's not been done yet. They're changing the way that GP training is done. So at the moment it's 18 months in hospital, 18 months in a GP practice. They're now changing it to 1 year in the hospital, 2 years in a GP practice. But they keep talking about making it 4 or 5 years or whatever, but it's not happened yet.
Right, so keep your eye out for that if you're kind of nearing the end of medical school, see if it changes anytime soon. So we've heard about what you liked about GP training and kind of the reasons you've gone into it. Are there things that you wish were different or that you don't like about GP training?
It's more of a lonely job. I personally don't mind that, but I know some people love the social aspect of hospital. You're working with lots of other doctors around the same age as you, and you know there's more of a team in the hospital. You work alone as a GP, and there's one other person of my age at my GP practice who's an F2. Other than that, everyone else is obviously older and they're qualified nurses or doctors or healthcare assistants or receptionists or whatever. So that's one of the things. There's a lot of admin involved with GP. So if you imagine that when you're in hospital and you order a blood test, you review that blood test. When you're a GP and you're seeing 15, 20 patients a session and you order a blood test, that test will come back to you. And you've got to do that in your spare time, so in your lunch breaks basically. And you've got to action all of the reports when they come through. You've got to do all the referrals to the specialties. You've got to see all the discharge summaries.
I was going to say, all the discharge summaries.
Exactly. So if someone's been in hospital and they want the GP to do something, you obviously have to do that as well.
And there's always the case of, as an F1, you've missed something for a patient and they're just like to be, GP to review in a week.
Exactly.
It's always the classic.
Exactly. I mean, they streamline it because those summaries will go to someone who triages it in the practice, and then only if it says action for GP will it actually come to you. If it says something like book blood test, you won't even see that. That will go, someone will book the blood test. But if it says something like, and you'll just get the results of the blood test, but if it says something like, please review wound in 2 weeks, then obviously you have to see that patient as well. So there's a lot of writing and admin involved that you have to fit around your things. So even though a shift may finish at 5, you'll find that GPs wouldn't read until 7 because they're finishing that paperwork.
And I imagine that as you go further through the years and become a GP, you're seeing more patients, so it kind of exponentially goes up, doesn't it? You have more patients and more things to do with that, and then there's more discharge summaries, more blood tests and everything. So.
The most difficult thing about GP is that there's a lot of grey area where you just don't know what to do. It's very simple when you're in hospital because if someone is not sick, they can go home. You can give them advice and they can go home. If they are sick, they stay in and you treat them. In GP, there's a lot of this grey stuff in the middle where someone is not so sick that they necessarily need to go to hospital, but also they're not that well either, so you need to try and do something about it. So you get a lot of these blood results that someone's kidney function is slightly off, and you're kind of thinking, well, what do I do about this then?
And it's not as simple when you're in hospital, you can just repeat them the next day. You can't, obviously you could do that in GP, but it's not that simple. You can't just say, I'll repeat tomorrow morning and see what happens.
And it wouldn't be practically possible to do that for every person. So that is the most difficult thing about GP, is this grey area of not knowing what to do.
So we've kind of heard what you like and dislike about GP training. Is there any advice you want to give to our viewers out there that potentially thinking about GP training?
I would say get experience in it. That's the same with everything. Any specialty you want to go in, try and get experience in it so you can actually see what it's like. If you are seriously considering GP training, then try and tailor your foundation tracks to GP training. And so the main thing I mean by that is try and do pediatrics as an F2. That's the main one. Everything else is fine, but try and do pediatrics as an F2 or gynecology or psychiatry. The reason to not do it in F1 is because as an F1, you are working doing very basic stuff. As an F2, you work as a senior house officer, so you're on the same rota as the GP trainees and the core trainees and everyone like that, so you're doing the proper job and the proper on-calls, and that's where you get the good experience.
You actually see all the real conditions, you're not just kind of doing admin tasks, essentially.
Exactly.
You're having to use your brain, diagnose people, initiate treatment, so it's more realistic and you'll learn a lot more.
Exactly. GP is an okay job to do in F1, but if you do try and do it later in F1,
Can you do it in F1? I thought it was only F2.
some people can. So in a hospital you could, but you can't prescribe. Yeah, so that's a bit of a difficulty. The only advantage of doing it in F1, I guess, is that you understand it. So then your applications are going to be in the winter. So then you know definitely if you want to do it.
Yeah.
Because if you've not done it much at medical school, then you've not got experience, then F1 or first job in F2 is also cool.
But always bear in mind that you might see 5 or 6 patients in the morning. A real GP is saying like see like 15 patients. So kind of scale it up to know what a realistic day is going to be like. You're not going to have that much spare time.
I still see like less than half the number of patients who are in GP.
It's crazy, isn't it? And then all the admin on top of all that.
And if anyone has any questions about GP training, about what it's like being a GP trainee, about applying, about what jobs they should do, anything like that, drop me a message. My Instagram link is on my channel, or
We'll drop it down below as well.
drop it down below. There you go.
So thanks for watching, guys. I hope that really helped any of you thinking about GP training, or maybe swayed some of you into thinking about GP training. If you want to know more about GP training, then we've done a video with another GP trainee, which we'll link up there somewhere. And if there's any other specialties that you want to know more about, we've done some more videos as well, so give them a watch, or just leave a comment down below with any specialties you do want to get to know more about, and we'll try and find something for you. If you all start saying neurosurgeons, that makes it very difficult because we don't know neurosurgeons. If you like what we're doing, subscribe to our channel, leave a like on the video, and we'll see you next time.
I've been Varun. This is Scanning the Mind. Bye.